We'll now hear from a cube called Bringing Gentler Treatments for Metastatic Cancer Therapy to Light. Bringing together faculty from the College of Engineering, the School of Dentistry, and the medical school, this cube also includes graduate students and a postdoctoral fellow from engineering. Let's welcome Professors Mohammed El-Sayed, David Cohn, and Ken Koslev.
Well, good morning, everyone, and thank you for coming, and thanks, Valerie, for the kind introduction. My name is Mohammed El-Sayed, and I'm joined here by my colleague, Ken Koslev, and David Cohn. And what we would like to share with you today, our effort to develop gentler treatment for prostate cancer. As shown here in the figure behind me, prostate cancer is actually the second most common cancer in men. After skin cancer, 1 out of 6 men will be diagnosed with prostate cancer during their lifetime in the United States. So it's a prevalent tumor, it's a prevalent disease, and based on the statistics of the American Cancer Society, we expect that they estimated that in 2013 we will have 240,000 new cases of prostate cancer diagnosed in the US, with approximately 30,000 deaths. And the cost associated with the treatment of prostate cancer ranges between $8 to $10 billion per year. So it's a significant health problem. Now, current treatment options for patients diagnosed with prostate cancer typically revolves around radical removal or surgical removal of the prostate gland. And in this case, patient diagnosed with prostate cancer and they remove the prostate gland, they have approximately 100% survival after 5 years. But the problem, or the most challenging problem in prostate cancer, is the metastatic disease, when the prostate cancer cells leave the gland and go to other organs in the body, primarily the bone. In this case, this unfortunate population of patients, they have approximately 29 or 30% survival rate after 5 years. Now, to see a visual for the magnitude of this disease, the picture behind me for the bone scan shows these dark spots scattered throughout the body. They are in the skull, they are in the skeleton, the rib cage, the hips, throughout the body in multiple sites in the bone, because it's the primary site for metastasis of prostate cancer. If you take a closer look onto one of these lesions, you will find this abnormal growth of bone that's mechanically weaker compared to the structure of intact bone, and it's associated with severe pain, and it dramatically reduces the quality of life of the patient, in addition, of course, to the pathology of the disease. Now, for patients diagnosed with metastatic prostate cancer, what are the current treatment options? Unfortunately, they are not pleasant. They are very harsh treatment options. They involve cutting the patient. Surgical removal of the prostate gland is one of the earlier treatment methods, and it's still commonly used in the clinic. They involve burning the tumor tissue, and that's using radiation therapy, and obviously has many dramatic side effects, or poisoning the cancer cells using a combination of chemotherapeutic agents and hormonal therapies. But unfortunately, these toxic agents are not specific to cancer cells. They are actually affecting other organs, like shown here, the heart and the liver, as sort of collateral damage to these organs is observed in the treatment. So, what we are trying to do through our collaboration supported by the MCubed project is to bring our expertise together to try to develop a gentler yet effective treatment for prostate cancer that will not cut the patient, will not burn the patient, and will not poison the patient. And we are building on our collective expertise. For me, I'm the biomaterial guy. I'm the guy who designs and synthesizes materials. Here are those two schematics show different systems that were developed in my lab. We have the capacity to build materials that can deliver small molecules or even DNA and RNA selectively to the diseased cancer cells. And we capitalize on this skill to develop the system that my colleagues will describe in this project.
Uses molecular imaging tools to directly visualize bone metabolism and drug delivery to the skeleton. So here you see a mouse that's been injected with a fluorescent tagged version of a drug that's most commonly used to treat postmenopausal osteoporosis. Our efforts in the past have been focused on diseases of low bone mass resulting from genetic mutations or changes in hormonal status or changes in the environment. And the MCubed program allows us to use these molecular imaging tools to directly visualize drugs in a metastatic site.
So one of the focal areas of my lab is to make materials that can facilitate the regeneration of tissue. What we're really trying to do with this technology is make materials communicate better with the biological world. Most man-made materials, if you put them in a biological environment, function like a grumpy old married couple. They may physically be occupying the same space, but not optimally communicating with one another. So one of the things we're doing is tethering peptides or amino acid sequences in which one end of the peptide has specificity to a specific material chemistry, and the other end has specificity to a specific biological entity, such as a type of stem cell. And by tethering the materials world to the biological world, we can literally fill a hole in a head, at least in an animal model. So through a combination of material science and cell biology, we have the ability to regenerate tissue, in this particular example, bone. So it's these peptides that tether the materials world to the biological world that we're trying to now use for a completely different application in this MCubed project. So for 20-something years, my lab has been making materials with the objective of improving the ability to regenerate tissue. And a couple of years ago, one of my brothers-in-law says to me, says, "Dave, are you ever going to leave Michigan and do something different with your life?" I said, there's two questions in there, not one, because I don't have to leave Michigan. One of the beauties of being a professor at a place like U of M is I can switch gears and undertake a different line of research if I can overcome an energy barrier. And MCubed provided the ability to take a detour and redirect part of our lab's research without physically moving. So prior to MCubed, maybe I could spell cancer if you spotted me the C and the A, but this application wasn't on my radar. But one phone call from Mohammed and the light bulb went on. I say, hey, that's an interesting potential application to use our peptides with. So MCubed provided the catalyst for redirecting without having to move, without having to leave the confines of Ann Arbor. I'll turn the mic back to Ken.
So the overall concept of our MCubed study is to develop modular, targeted nanoparticles for imaging and therapy of metastatic prostate cancer in bone. Using Dave's expertise in generating ligands that interact with biomaterials in the extracellular environment, our first module is a targeting agent. This will deliver our drug, our anti-cancer drug, directly to the tumor lesion in bone at sites of very high bone turnover, which are characteristic of prostate cancer metastases. Our second module is an imaging agent. Here, a near-infrared fluorescent tag will allow us to directly visualize drug delivery to the metastatic sites, real-time in vivo. This will also allow us to visualize the drug interactions with the tumor tissue on tissue biopsies. Both of these modules are incorporated into a smart nanocapsule. This nanoshell encapsulates anti-cancer drugs or chemotherapeutics and is designed to release the drug only under conditions of low pH that are characteristic of the tumor microenvironment. So this multi-composite approach with these three different modules should allow us to have very high specificity of drug delivery and release at tumor sites and avoid some of the potential side effects associated with off-target drug delivery. Creation of these compounds is a long and arduous process, as you might imagine. We view MCubed as, MCubed has provided us with the financial resources to really create first-generation compounds with these three imaging, targeting, and nanoshell capabilities. This has allowed us to pursue additional funding through different extramural sources, but as well as we all know, the funding environment is relatively low these days. Most recently, our proposal to the Department of Defense for this project received a very high 6th percentile rating overall, but was still well outside the funding range. Ultimately, we view MCubed as a catalyst for this type of high-risk translational research. Our goals are to take these nanocapsules and develop them, and then bring them from the benches of our 3 individual laboratories out to the bedside of the metastatic cancer patient within the clinical setting. Our MCubed family has grown beyond the 3 individuals on stage here today. We've been joined by Evan Keller from the Department of Urology, who's providing us with preclinical models of metastatic bone disease. We'd also like to thank Yasmin Durmaz, Omar Aden, Ibrahim Youssef, and Harsh Rambaraju for their contributions to the study. Lastly, we thank MCubed for their continuing support of our work and for the opportunity to present this work to you today. Thank you very much.